Well, I'll be the first one to say I think I was very typical. The time I was diagnosed, I was 26 years old. It was around 2002.
Hmm.
So let's go back the better part of 20 years,
Yeah.
where it's the era was a little bit different. Perspectives were definitely different. I was your standard young adult where I firmly believed that I was invincible.
Yeah.
And I looked at life as in this big open book that was in front of me. There were no questions, there were no challenges. I could put things off because I'm going to look and feel like this forever. It'll be fine. And it was a bit of a blindside whammy. So I'll be the first one to admit it was definitely the best kick in the pants I ever got that I
Yeah.
didn't want, but I'm glad it happened.
What was the very first thing that you noticed as being a bit unusual or not right?
I noticed it, frankly, I was going out and socializing with friends, and I just felt kind of uncomfortable sitting. I always felt like I had to shift, for lack of a better word. Like
Mm-hmm.
there's just the package wasn't sitting right, and I'm like, why does this hurt like that? I didn't quite get it. But again, completely oblivious to even that being on my radar.
Mm-hmm.
So I just thought of it like, oh, maybe these underwear shrunk in the dryer and
Mm-hmm.
just need to go get a new pair or flip the boxers and call it a day. But nope, it was early warning signs.
And to me, that sounds like you weren't in excruciating pain. It was just a bit uncomfortable.
It That's how it started, and then it was kind of a deep dive in the span of 5 weeks, where it went from starting off as what was a bit of an uncomfortable twinge to my one testicle getting to the size of a small kiwi,
Right.
and within that progression, again, like I just thought, okay, well, is it is there a backup in the pipes, or like I was just guesstimating all these things. Personal family
Mm-hmm.
history, medically speaking, my father's side of the family was riddled with heart disease.
Okay.
So from a young age, I was very aware. Eat like a heart patient. Be mindful. Have a good
Mm-hmm.
regimen between diet, between exercise, general wellness, self care. Even before that was really a term, and that I kind of had my sights set on. But cancer wasn't even something I even contemplated.
Mm-hmm. So from the time you first noticed it, and then 5 weeks had passed. During that time, in the very early stages, do you think a partner would have noticed that there was something unusual, or do you think it was more just you as an individual would have noticed? So I mean, like for another person, kind of visually, do you think they would have been like, "Oh, there's something a bit unusual"?
Well, with the hindsight being 2020, and also just fully speaking, that it's been 20 years. Um, I would never have dared to even consider sharing that with a partner in an intimate perspective because it was so private.
Yeah.
And I look at I can only speak from the North American experience where there is that innate sense of, well, it's your private parts, and there's an immediate sense of shame where
Mm-hmm.
if there's something going on with you and it's a gender based issue, you keep it to yourself. And even the idea of going in and talking to a medical practitioner, you have to get over that first initial hump of there's something wrong with me down there,
Mm-hmm.
and how am I supposed to deal with that when I've never even had that kind of conversation level. It's never been demystified. The taboo hasn't been taken away. It's this immediate sense of shame. That's really the only
Mm-hmm.
word I could use.
Yeah.
And the 5 week process was me not having a general practitioner, and I was visiting Toronto General Hospital in the Emerge ward ritually once a week, coming back. And I use humor as a coping strategy all the time, and it can go dark. I'm not gonna lie, and I find that as I like to say, as chemo sabis, we definitely welcome the dark humor because it's a great stress reliever and a great means of decompression where it's, oh, I can talk to somebody who gets it. I don't have to coddle your feelings. I don't have to worry about you worrying about not being able to help me.
Yeah.
And within that realm, by the time I got to week 5, it had grown to the size of a small kiwi, and I was being misdiagnosed each week from things like mesenteric adenitis, that was a viral infection that can start in the lower abdominal lymph nodes and metastasize down to emulate certain conditions. Testicular torsion was on the map. STDs were there, and of course, I was shaking my head, going, I haven't gotten none in the past bit, so I don't even know how that happened.
Were you in an intimate relationship when this happened?
No, I mean, frankly, at the time, I did have a roommate, and we did have a very transparent relationship. And I did kind of at points mention, "Oh, I'm kind of, how should I deal with this?" But again, it was both outside of our realms, where we're creatures of being mindful and aware of our circumstances based on our experience leading up to the point of. And when you think about something like cancer that immediately confronts you with your mortality, it's that kind of in the room, like when you say, "Oh, so and so, they have cancer." You never say it with a loud, full voice. It's always that undertone of, we don't want to talk about that because you don't want to bring it on yourself in some spiritualistic, superstitious sense of you've now become a lightning rod for bad juju.
Yeah,
so
it's a scary word.
It is, but I'll also be the first one to say that it was the most unwelcome teacher that I didn't know that I needed. And it definitely shaped a lot of things into perspective, especially in that week 5 when I'd gone into Toronto General again, and I lucked out that there was a urologist who was working in the emerge floor.
How many doctors had you seen until you saw that urologist?
Well, at that point, 5, once a week. I was working as a bartender, and I was finishing my shift at 2:30 in the morning, and I just walked over. It was like, "I'm back again. It still hurts. What's going on?" And up until week 5, I was just getting sent home with painkillers and antibiotics.
So it's getting quite painful at this point.
Oh, it was excruciating.
Right.
Like my pain scale was probably cruising at about an 8 out of 10.
Okay.
And it was, I mean, I was going commando at that point. I was wearing very unflattering pants just to let things just sort of sit where they were going to sit. I stood as much as I could, and then I went, I would lie down and not sit down. But then once everything came to a head, where everything was determined, Frank, I'm really grateful that I had that urologist that day. I was diagnosed as stage 3A. And he said, "You've got testicular cancer. We need to get this out of you now." And
can I just check? That was sort of an emergency room visit where you had finished work and you were just like, "I need to go to the emergency room," and it was kind of just down to luck who you ended up seeing on that day.
Well, yeah, at this point, by the week 5 point, I had let them know, say, "Look, the pain hasn't gone away. What do I do?" Said, "If it's still there, come back." And I just gave it a week. And then by week 5, I'm grateful to whatever the universe decided to give me that particular practitioner who was there that day, and without a second hesitation said, "Ultrasound CT, let's go." And after everything was determined, I do like to joke about it sometimes, where I say my roommate was with me. He was a DJ at the bar that I was working at. And I'm standing there in my hospital gown. I've got ultrasound goop following from my nether regions. And I'm looking at the GP. And as soon as he said, "You've got testicular cancer," my roommate starts freaking out, going, "Oh my God, you've had cancer." And I just put my arms around him saying, "It's okay. It's not you. You'll be fine. Can I have a painkiller now?" And that's how I left it.
And you were so young at the time as well, and just actually trying to cope with that emotionally. And it's kind of like, it's very interesting. Like the roommate was there, he didn't really know what to do. He's freaking out more than you. You're having to reassure him. It's a very, I can really kind of imagine you as a young man just trying to survive emotionally in this situation. And it sounds like it was kind of almost like emotional chaos for not just you, but anyone that was sort of close to you at the time.
It definitely was. There were, in hindsight, there were some, if I could say, positive coping strategies that took place, and then other reactions that necessarily weren't the greatest.
Where were you emotionally at that point? So that day you got the news that you had cancer. Do you remember what kind of emotions came up for you then in the kind of the next couple of weeks, trying to come to terms with this?
I learned that I've always been a bit of a structured prioritizer, and I'm a big fan of critical pathing. So I look at the end goal, and that was one of the first things I asked the practitioner. I said, "Look, what am I in for? Like, what are you going to do?" And he said, "Well, first thing we have to do is we have to remove the testicle. Would you like a prosthetic?" And I did go to my back pocket of jokes, and I immediately asked, I said, well, do I have an option of a disco ball? Can I perhaps get a magic 8 ball, give it a shake? Things are looking up. Like, what can I do? And he's just kind of looking at me going, you're handling this abnormally well. That if I let myself feel, I don't know what's going to happen. I don't want to lose focus and give you my clarity, because there's no one here. I mean, my roommate's a mess, and I'm obviously I'm going to be my own advocate, and I have to try to figure out how I'm going to navigate this as quickly on the fly as I can. And ironically, kind of, high volume hospitality sort of taught me that, where you've got, customers are 7 wide, 3 deep, and you're slamming out drinks as fast as possible. You have to prioritize. And I just extrapolated that towards what was going on to say, what's next? What's the game plan? I had a second job that I didn't care for too much, and I'd only been there for 2 weeks. The next morning, I called my boss and I had to quit. I said, I just got diagnosed with cancer and I don't know what's going to happen. So I should probably resign. And, of course, I did play it up. It got a little dark on my side, and it probably wasn't the nicest way to quit things. But for me, it was a clean break. And I looked at what I needed to do in order to maintain for myself and just try to navigate. My mother was living in Europe at the time for work, called her up immediately and said, this is what's going on. And I don't mean to scare you, but here's what's going on. Yeah. And the orchiectomy, fortunately, was a success.
Can I just ask about when you got the news that the treatment, because I'm assuming that you didn't really know what the treatment was for testicular cancer at this point. Was this the first time you ever had heard of what the treatment would be?
Oh, my only compass was what I knew in media. So from what I saw in film, what I saw on television, all my stereotypes in my head of, okay, cancer means chemotherapy, means I'm going to lose all my hair, and this is what's going to go on. And I just tried to take a step back and say, okay, what am I in for? And they said, well, this is what we'll do immediately. And once those test results come back, we'll have a sense of what to do next. I said, okay, I'm going to worry about each bridge when I get there. What's my worst case scenario, just so I don't have to go into an emotional crash position?
Sure.
And that's how I navigated it. And in hindsight, I'm actually, if I was to go back in time and say, 26 me, you did good. Like you handled that pretty solid, all things considered. And I didn't really have my emotional breakdown. At the time, it was December 19th, 2002. I find that any cancer survivor, we all remember our diagnosis date. It's just this bright flash of, whoa, that just happened. And the holidays were definitely difficult, because that's when I let myself start to feel things. And I went on to my chemo treatment really quick. They said, the opportunity here for blasting your system for a cleanup is really strong. Ironically, Toronto was going through SARS at the same time. So what's going on right now with COVID, again, I say it in jest, but when I talk to cancer survivors who have compromised immune systems, we look at this and just go, we got this. We know how to deal with this stuff. Like when you have a compromised immune system, you're super careful. And so I'm grateful for that experience, where it set me up for what we're going through now globally. And in the moment, there was no way that I could have really anticipated the reality of chemotherapy treatment, but it was, all I knew was what I'd seen from TV.
Yeah. So when you learned that the treatment was going to be that you'd have a testicle removed, how did you feel about that at the time?
In the moment, I'll admit, I was very focused on getting through it.
Yeah.
Like that was I just didn't understand. I had so much information coming my way, but in fairness, I was also asking for it to try to evaluate, all right, what's my best plan of attack? And what do I do from my responsibility side? One of the jokes that they said in the chemo nursing ward is they go, this guy just does everything 4 times over, like whatever they tell me to do, is because I had already accepted myself as a person, knowing I wouldn't forgive me if I slacked off, if I didn't do everything that I could do, because then they say, well, unfortunately, this is what's going on. If you had, then I just would have dropped. Like that level of blaming myself, no. But that's just knowing me as a person.
So you're super responsible. What was the chemo like?
I feel that my nurse described it best to me when she said, your experience is going to be cumulative. Week one, you're going to feel like by Friday, it's like you're going to get hit with a bat on every side of your body. You're going to have this spontaneous bounce back in your appetite over the weekend. Don't be surprised. And then we're just going to have to keep hitting you for 6 cycles. And by the end of it, you're not going to be in a very good place. But I did appreciate that. I didn't take it as a scary thing. It was more, I was prepared. And I just went through my process and I continued to listen to my body. And granted, this was with no guidance. Like there was no, my family had really no experience, as I had said, when it came to cancer. So it was, my dad's family is a Greek immigrant. And there was a lot being dealt with on that side too. Unfortunately, I had one aunt who took advantage of the opportunity at the Christmas table after diagnosis saying, being an out man, this is your punishment for being gay. And my response was, well, I'm not going to go to the church. I'm going to beat this and you're going to eat crow as far as I'm concerned. And as irony in the universe would have it, she was about to clap back at me. And of course, being the matriarch of this side of the family, the whole table was just in awe going, whoa, Peter, like completely fired back without thinking. As she was about to rebuttal, her dentures hit the plate. And I was like, that's karma. Amazing. This conversation is canceled. And I'm glad whatever divine intervention exists, that moment would take place. And it was just, okay, cool. I got through that moment. And
I mean, it's so crazy that you had to deal with that, while you were going through everything else. I mean, it's just the last thing that you needed to be hearing.
It turned out to be a little bit of a blessing in disguise, believe it or not. And I've joked about this before when I talk to people. Regrettably, I lost my father almost 5 years ago, actually, in a couple of days. And cancer was kind of like this get out of gay jail free card, where the focus got so zeroed in on my health that became secondary. So once I started getting better, people were a bit more easy about it. My dad, his siblings, all living in Canada. It was a growth process, and it definitely moved itself forward where before my dad had passed, my spouse, who I've been with now for over 10 years, we've been married for almost 3. He openly acknowledged him as his son. We got married on my dad's birthday before he passed away with his blessing. It couldn't have worked out better. And it was a lot of invested work and time. My dad had got diagnosed with lung cancer a month after he quit cold turkey from smoking. It was just such a backhand. But then his first diagnosis, he bounced back. But unfortunately, his second diagnosis just came fast and dirty and took him hard. And I was able to be there for him for his treatment. And he would ask me, does chemo hurt?
Yeah.
And to be able to be there for my dad, not just as his son, but as his friend. And I was able to really call on, at that point, a number of years doing peer support in the young adult cancer community. And I'm the oldest of 3 boys. I look at every time I meet another survivor, we're tribe. That's bottom line. And when you're with someone who gets it, you can take the armor off. You can just say, I can let my scars out and I don't have to worry about, navigating your emotions in the process, because you're probably going to tell me some crazy story that's going to blow my mind anyway.
Yeah.
And I just get very excited when I get to meet another survivor. It's like, I want to know your story.
Right.
And I get very amped up, and I don't hide my facial expressions at all. So
talk to me more about the chemo so that I can understand that process of the treatment for you, because that sounds like it was really tough.
I would describe it as an increasing amount of malaise and just weakness. I'm a very gym savvy person, and I was before I went in there. I got from about 180 pounds down to 140 by the time it was done. And it was difficult trying to keep up not just the weight, but also my overall sense of energy and how I was navigating my day. I was very fortunate that I wasn't someone who had a lot of vomiting that I had to deal with, but I was in perpetual nausea for about 6 weeks. And it was just really tricky how to gauge that. And then at the same time, I was still bartending at night. So I had, my employer was great. He just said, whatever you can do to not look sick, You can keep working. I'm like, as long as you're okay. I'm like, yes, I'll plug through it just because I'm convinced that my blood type is piss and vinegar and I was not going to compromise for anything. And I got through it. I treated it as the end goal. There was definitely physical deterioration where I felt, I don't know if I could say muscle wasting, but it was that being aware that things were getting weaker and weaker. But I just kept coming back to one of my nurses telling me the people who get through this, they understand two things: perspective and attitude. And that's what I adopted. And I just looked at it as, this is my fight. And I called on my Greek heritage and my Spartan roots and like, let's do this. And I didn't back down.
So you said there was 6 parts to your chemo treatment. Could you just tell me what each part involves when you go in? How long does the treatment last? And just talk me through the whole process.
Yeah, so my specific process was I had 6 cycles, and a cycle was inclusive of 3 weeks. So my first week would be, what was it, cisplatin, bleomycin, and there was a third drug. And then week 2 and week 3, so that was for 5 days a week, and it was for 3 hours a pop. And then for week 2 and week 3, I would just go in once a week where I got Decadron, which was a steroid, to try and just try to keep things up. And give me something to work off of. It wasn't anything at an anabolic level, but it was just part of the process to try and help my immune system deal with the chemotherapy that was in there to do its job. So, times 6, and I was looking at 18 weeks altogether where I was in the chair, and it was really hard. I could never. I mean, everyone. It all depends, of course, the type of cancer, the diagnosis, the treatment that's required. Chemo can vary, where mine happened to be all clear, and there were other people in the ward where they had blue, they had red, and it's got different effects. Sometimes it's a lighter therapy, other times it's really intensive, depending on what's going to go on, and the side effects can vary, all depending on the individual. I did lose all my hair, and it came back wavy, which is crazy. But then
So
when
you
I
had
got
straight hair before and it came back wavy?
Yeah. It's kind of a joke. When I was in high school, it was during the height of NSYNC, and I remember thinking to myself as a kid, I was like, man, I would really love to have that, sort of like tight perm blonde hair that Justin Timberlake has. Yeah, that's how it grew back after chemo. So be careful what you wish for.
Yeah.
You don't know how it's going to hit.
So crazy that it does that to your body, that you end up having like a different hair type afterwards.
Well, there was when it did come back. I remember. Sorry, actually, it was one of the nurses. She said, "I've had patients come back where it looks like your hair has been bleached and permed from the inside out, and that's from all the chemicals going through your system." There was one woman who was in my local group, and she was just like your typical Japanese girl, but her hair came back with this beautiful wave. And she was the envy of her culture because they pay so much money so that they can get that. She's like, nope, I got the bounce and it's going good. And she milked that for everything it was worth. So silver lining, ironically. But definitely within the spectrum of treatment and experience, there were some like really neat little hacks that I figured out. One was, at least for my chemo cycle, and my dad's was very similar, you typically end up having like this really strong metallic taste in your mouth, and you want to try to get that out as quick as you can. Anything with a sharp flavor really works well. I was going for like super old cheddar, anything that was like I'd bring in drinks that were high citrus content, so lemon, lime, and then also any brand of candy that's got a sour edge to it will just flush out your palate.
Right.
And it helps get rid of it. So anybody watching, it's a great hack. And
Amazing.
It helps. Try to keep the sugar content down, but at least get the sour in there so it can take care of that metallic.
How long were you without hair for?
Oof. I remember, I want to say the better part of at least 8 weeks. Meaning like, sorry, during treatment, or how long it took to grow back?
Yeah, just kind of been told, how long did you have that look where people might have looked at you and thought, he looks unwell?
Oh, geez. Okay, so I was warned that I would be anticipating hair loss if, like, with my particular combination. They said likely you will go through hair loss, and I was your stereotype aggro. The first day of chemo, I went home, put the clippers, just did my whole head right then and there. I was enjoying like the peach fuzz feeling for a bit. It's like, oh, this feels so neat. And then I think it was by the next week, Monday, I rubbed my head and I saw all these bristles on my hand. I'm like, okay, let's go. And I just went into the bathroom and I got a face cloth. I wet it down and I just rubbed my whole head and I saw everything come off. And it was, that was hard.
Yeah.
That was hard. Then it was real. And I realized, okay, what's going on? And I successfully held on to my eyebrows. I was really careful when I slept. Like I immobilized myself in bed. I'm like, nope, don't roll over. Don't wipe your face. Let's like pat dry everything. And I was still able to grow facial hair. And at that point I was sporting this like really cool, like beard line that came to a point. I had one night I rolled in my sleep. It came complete off. I was like, oh, well, guess I'm gonna go just wipe my face or shave and do that. But I remember my eyebrows went gray, and I was also very guilty of avoiding photos. I
Yeah.
only have two, and that was I had a Fun Saver camera, and the lady at the counter said, you know, you've still got a couple pictures on this. You might as well snap them. And she goes, let me take a picture of you. You've got a really nice smile. And I was so shy. I was so ashamed. But
Yeah.
I'm actually really glad that I have them because it lets me remember and
Yeah.
it takes me back to that time.
Did you worry about how other people were perceiving you when you looked like that?
I was really doing my best to keep up a front.
Yeah.
I really concentrated on what I could accomplish in order to have that sense of normalcy. My only real moment that jumps out is I did go out to. I'm very guilty of karaoke. I know I can hold my own in a bar, and I love to sing. In fact, I even hosted a show for a while. But well before then, I went to a local night to visit my friend who was hosting the show, and I ran into a friend I hadn't seen in a while, and he very awkwardly asked, like, you know, how are things going? And I said, well, you know, I got diagnosed with cancer, and you know, I'm just going through chemo right now. And he goes, oh, I'm so glad to hear that. I thought you were HIV positive. And I was like,
You know, it just shows you what assumptions people can make when they see something or someone who looks a bit different.
I didn't know how to initially react, but fortunately at that point I had navigated my immediate family's feelings, and my first reaction was I have to remember that when people speak to you, you're an ambassador for whatever's going on in your life, and that could be applicable in any sense, like either dealing with a disease and what you're doing for work. Like if, like say for example, if you're LGBTQ or if you're transitioning, like you're always an ambassador for that brand where people might have that natural curiosity, but it could come out in a nervous question or a nervous statement where they don't mean to say something offensive, but just
Yeah.
it pops out, and you're like, okay, I can choose how to react. That's the only power I have.
And you get an
And if I
opportunity to educate people.
exactly. So I learned that really early on, and I'm grateful because it's functioned as a great litmus test and as a guiding force in meeting and integrating with people throughout my life, and just knowing, you know what, I got to listen twice as much as I speak because I can't put myself in someone's shoes until they help me walk.
What happened next for you?
Next was me finishing my chemotherapy treatment. And once all the results came back, they said, well, it looks like, you know, we verified the type of cancer that it was. It was a 7 centimeter tumor. It had pushed it out to being that size. It was a non-seminoma tumor at that point. And they said, as far as we know, it didn't metastasize. However, there are some dark spots in your abdomen, and we don't know if they are unaffected tumors or they're burned out lymph nodes. We
Yeah.
don't have a way to monitor that, so we need to decide what to do. And forgive the pun, my gut reflex was, nope, I don't want them out. They said, well, you did bleomycin and it caused fibroid scarring in your lungs. You can't get 100% oxygen once you're under. If you do, you're not going to wake up. So your odds are really 50-50 if you want to do this procedure. And it's the third most invasive procedure you can do on a person. It's a RPLND, a retroperianal lymph node dissection. So I ended up opting for it at that point. I was 27. It was not even just 6 months after my initial diagnosis, and it was on August 1st that I made the choice that I was prepared to go in. I only told three people, maybe about 3 weeks before my surgery, what my actual odds were.
Yeah.
because I didn't want to have to deal with any possible drama from my family or this. Like, if this was my time, I wanted to go out on my terms, and I wanted to also not have to worry about emotionally coddling members of my family trying to fight and who's going to be with me last and say their goodbyes, just so I had to wake up and then know that I put them through that. And there was a bit of like a kismet to all of it, where I've been encouraged through a psychosocial oncology therapist to journal write and stay on top of things, my feelings. And I got to my last page of my journal the day of my surgery. And that was after July 31st, where I thought, what am I going to do for my last day? Because it might be my last day. And I thought, do I want to run up my credit cards? Do I want to, what am I going to do? I decided to go to a video arcade while those still existed. And I spent 3 hours playing fighting games and just having the time of my life. I just happy, laughing. Ironically, a mother and her child decided to come into the arcade, and he was like, "Oh, I want to play you against this game," and I was just destroying him. And he just turned, looked at me, and he goes, "I hope you die." And then I looked at the mom, funny story, and I told her what was going on, and she's like, and she just took her kid out, and I could only imagine what happened after that. But I'm sitting there laughing, going, "Yep, that's a good way. If this is my last day, that was fun."
Yeah.
And I went in on August 1st. I remember 6 a.m. and I was ready to die. And I didn't really hit me until I got to the anesthesiologist, where I told her what my concerns were, and she just held my hand and said, "Look, I just need you to count back from 10, and whatever's going to happen is going to happen." I woke up, and I was floored that I woke up. And the same anesthesiologist came to me, and she said, "I'm sorry, I get emotional sorry when I talk about this." She said that you went to sleep with the most wonderful smile. You were okay. And I was ready. And I can't properly express what that feels like. And then trying to find your way after, because it's this massive challenge. And I took it head on. I felt like I did everything the best that I could do. And then just, okay, where do I go from here?
Yeah.
And it was really hard to find meaning after that. It took a while. Funny enough, 3 years later, I'm getting ready to go to work, and I felt this familiar twinge in the other testicle. And I thought, okay, all right. And I went to work, and I did the same thing. I went to the same hospital. I said, "Hi, thought I graduated as an alumni, but apparently I got a couple courses to finish. I'm not leaving till you tell me it's not cancer."
Yeah.
Almost 36 hours later in the hospital, where I refused to leave, and a full day.
Did they want you
vendor
to
food.
leave? Were they kind of going like, "No, I'm sorry, like we can't do what you want us to do"? Were they trying to dismiss you?
Well, I learned that medicine works from the broad to the specific. And for me to come in and specifically say it's testicular cancer, they're like, no, I mean, probability wise, that's almost impossible. I found out afterwards there's a 3% chance of bilateral testicular cancer with a time difference in between. I caught it at 1A. And they were just, "How did you know?" I was like, "Because I know what it feels like."
Yeah.
So if I ignore it, that's on me, because I know what I'm in for. And sure enough, I was able to avoid chemotherapy because I ended up doing the RPLND. They were all burned out lymph nodes, so there weren't any unaffected tumors, but that was the natural route of metastasization. And there was nowhere for that cancer to go. I ended up having 7 tumors in the other testicle that were seminoma based. And I was speaking at a fundraiser outside of Toronto, and one of the nurses from Princess Margaret Hospital had said, "I know your last name." I go, "Oh yeah?" She said, "Yeah, you're in a medical journal." "What do you mean?" So, "Oh no, your diagnosis type, that never happens. You're like a unicorn." I'm like, he's like, "Do I get to sign autographs?" She goes, "No, you're just a number." I'm like, well, I think I'm a bit more than a number, but it feels kind of cool. I'm like, ooh, cancer celebrity. So it definitely put things into perspective. And I also learned that since the time of therapy treatment for testicular cancer, I think it was before the 90s, there was a mortality rate of somewhere around 90%.
Yeah.
That you're not going to make it through. But then they had found this new chemotherapy that they use as treatment for both testicular and ovarian cancer with early detection has an over 90% curability rate. So that is something that I took force forward. However, I'm also at the forefront of this generation of people who have done that treatment and don't know what's in store.
Yeah.
So I've learned to accept and metabolize that anxiety. It's no longer a Damocles sword, and I'm not going to look at it as I have to live every day like it's my last. No, I've done that, and that's really stressful. So I'm going to treat every conversation engagement like this is the only opportunity I have to meet with this person, live in authenticity, be mindful in the way that I speak. I'm really happy that I learned through work about level 2 listening and how to not only listen, but to hear and be there for people in their moments and just create some beautiful memories and be grateful for what I have. I've really taken it head on where in Canada, I know I'm one of the 2 biggest loudmouths when it comes to testicular cancer awareness. And I'm pretty big on my ink. And in the past couple of years, just because it was important to me to acknowledge and commemorate both family and close friends that I've met who've not won their fight. So I don't know if you can see, but I have names on my forearm and I'm up to 29. And it doesn't make me happy that I have to add anything, but I'm pretty sure I'm going to run out of arm space before my time comes. But bear with me.
I want to ask you about intimacy because of the procedures that you've had and things looking different. What was the kind of early stages of becoming intimate with someone like for you when it was kind of new for someone to see things looking a bit different down there?
Well, I've definitely analogized it in the past to the same experience, or at least the best I can understand, for a breast cancer survivor who has to go through mastectomy and then reconstruction. Within the testicular cancer community, there's a joke. We say, oh, there's uniballers and there's flat baggers. And this is kind of like how we navigate, just going through that emotional digestion of what you want to do. As far as I know, a majority of the time, TC survivors, their experience is very similar to mine. They'll offer a prosthetic in the moment, but then you don't really know what you want. So you just kind of got to roll with it, and forgive the pun. I just caught it as soon as I said it. And
was it hard to make the decision about whether to have the prosthetic or not when you've already got all these emotions going on and the fear and all of the being distracted by trying to deal with the fact you've actually just been diagnosed with cancer, as well as then trying to make a decision about how things are supposed to look afterwards, or making a choice as to how you want things to look afterwards?
Well, I did joke about it because that's just what I do. And with the oncologist at the time, and I had said, well, I don't want my remaining testicle to go through post-rheumatoid anxiety. So let's move someone in while the door's open, and we'll figure that out as it goes on. And when the second orchiectomy took place, again, like my sense of jovialness, I go, well, isn't that just like a vending machine testicle? Like there's 2 in every pack. So where's the other half that you snapped off? And he's just looking at me going, how do you do this? Like, you're just so cavalier. I'm like, well, because if I cry or if I break down, I'm actually not communicating anything to you other than I need a moment. And I don't forget that there are other people in this hospital, in this floor, who need you. So it's not to say that they're more important than I am, but I can do them a solid by trying to articulate myself as best as possible, as quickly as possible, and give you the data you need so I can metabolize my feelings after. And that's how I navigate.
Humor was like a massive thing for you all along. It was like, if I can use humor, I can put myself into a positive state, even when actually I feel like really not great at all about this.
I find that identifying as gay and coming out as early as I did give me a lot of the skill sets. Plus, through high school and university, I was on every improv troupe I could be on. So humor was always in my back pocket, coming back with a fast wit and making people laugh always made me happy. So finding, and it does also provide that comfort zone for people where they have that uncomfortability of, oh my God, you're going through this invisible disease that I can't do anything to physically affect, but I can give you kind words and maybe a hug, but is that what you want? And they're so apprehensive about what's the right thing to do, as opposed to what I've always advocated to anyone when they ask me that question: give cancer patients and survivors a sense of normalcy, because that's what we remember, and that's what will help us go through our experience and journey. Because we know, okay, if you're my rock, and let's say like you're my best friend or you're my sibling, and you're always like grinding my gears, grind my gears. I need to feel that, because that's going to help me get through this, when I know that even if cancer goes crazy, I can still count on you. And that's the best go-to.
Was there any avoidance of intimacy, or was intimacy difficult in the early stages, once you had gotten through things?
I, for the first bit, I mean, I was very apprehensive. I also, touching back to the equivocating for breast cancers and mastectomy, the difference is that mine was invisible.
Yeah.
So just putting on a pair of pants, you never know. But I knew.
Yeah.
And then that's where the self-doubt came in, questioning my validity. There's definitely ties to masculinity. How much more of a man am I, or less of a man, that I've been through losing one or both of my testicles? And then is having prosthetics enough?
Yeah.
And there was more the medical side to it, where with the RPLND, they had warned me there was a risk of nerve damage to the nerves that were responsible for ejaculation, and then also losing the testicles. All that would come out after that point would be a small amount of like prostate fluid.
Yeah.
So it just changed the context of everything that I was familiar with. And you think you're biological right. So I had to process my own identity and understand, okay, well, if I look at it in terms of percentages, this is what, 10%? Well, I mean, we all who are we are, but we'll say 11%, and of who I am. And is that really going to be the defining factor of what it means for me to be intimate with another person? And then I started realizing, wait a second, if this is what's happened to me, I still exist.
Yeah. I
didn't die. If you're going to have beef with me, why am I taking my clothes off with you?
Yeah.
And that's exactly how I looked at it. And I had some very wacky reactions from some people, in some cases. Not that there was a revolving door, but there was one in particular. I remember saying, "Oh, I can understand what you're going through with your cancer journey. I had a bad breakup."
Wow.
Yeah, just like that. I don't know how you endured. The struggle's real. I'm going to go try and hold down some food. You let me know how that plays out. You with your healthy stomach. And I didn't know what else to say, because it's hard not to feel blown away in the moment. So the intimacy side of it, definitely there's a coming to terms. And I would very wholly advocate anything in the way of psychosocial oncology therapy, whatever's offered by your hospital or your care provider in terms of consultation or counseling, because I've openly said it's like trying to go and do trigonometry without having any type of experience. You would intuitively go for a tutor, but we have this expectation that we should already know how to navigate our emotions. Sure, let me go grab the guidebook that I was born with and just flip to the part that tells me how to get through cancer. It doesn't exist.
Yeah.
And we're just flying by the seat of our pants. We're hopefully enough to have the wherewithal to go to people who have those credentials and qualifications that aren't our friends and family, because that's actually not fair. Like, they don't have the structured education in order to help deal with these things in a constructive, navigating sense, where we can see the end goal, versus, well, I'm going to do my best to not make it about myself and try to be there for you. It's a really heavy thing to try to take on. And I'm glad that I learned, I got formal training in peer support, because then I could see the difference that it makes when you have to find that grounded place to be that anchor for that individual, or you need to be their mirror, or you have to be their sounding board, whatever's required, but you do it in that constructive manner. And to tie it back to the intimacy part, I did tie it back to humor, and I found all different types of ways to crack jokes about it. And I mean, of course, I'm going to presume that this is a across the board spectrum age range interview, so I'm not going to start dropping specifically graphic things. but I've definitely found ways to make levity of it. And that was my coping strategy, where I gave permission to the other person to ask questions, not be embarrassed about it, but I had to be okay with it at that point.
Yeah.
And that onus was on me as a person to know how to approach both my health practitioners, doing research myself, not, of course, medical, just type everything into Google. That'll never scare you. No, don't do that. But reaching out to different groups, trying to find things that were relevant to my specific type of cancer. My first experience was reaching out and finding a charity called the Canadian Testicular Cancer Association. I ended up being their first national spokesperson. And that was, for me, part of my journey to come to terms with everything and just recognize it's just a part of my body.
Yeah.
It's like, I'm not going to be shy about my kneecap. Why am I going to be shy about my testicles?
Yeah. If a male has just been diagnosed and he doesn't know like who to tell, like he might, be thinking, I'm just going to tell a few people who are really close, but I'm not going to tell people at work because I might not get the empathy and understanding that I need. Different people work in different workplaces, and let's just say they have kind of concerns that if they tell too many people that this is actually going to start affecting their working life. And what advice would you give to someone who's kind of in that predicament of trying to figure out who should I tell and who should I keep this from, if anyone?
I find that there's a very heavy parallel to the LGBT experience of coming out, where you decide like what it is that you're going to share. And depending on your diagnosis, if there's something that's surgical or it's overt and something where you can optically gauge what's going on in the individual, that's your own personal story. And it's up to you if you decide that you want to share that. Some people draw empowerment from it, where they feel that they can convey what they need to. Others, they want to keep it a bit more private and very selective with whom they want to share. It's individual. It's completely individual. And I can only speak again from my experience. I did go through anger. I was definitely angry. My first psychosocial oncologist, when we sat down in session, he wasn't the right one for me before I moved to the correct one. But he did say to me, I would say you're clinically pissed off. And I was. I learned and understood that testicular cancer, there is no known cause. There's no real common denominators other than a couple of traits where they know it's more atypical in men. The age range is between 16 and 39, but within that range, typically Caucasians with dark hair and dark features. Seems to be a commonality, but that was just a general observation. Other than that, I've got every male in my family smokes except me. And then I was the one who got cancer. Like, I was just angry because I was the one who went to the gym 5 times a week. I had healthy food. I knew what to do. And then, bam, I got hit with this. I'm like, no.
Did you initially do anything maladaptive with that anger, like excessive drinking or anything that was kind of initially just not serving you very well, just as a kind of temporary coping mechanism?
I found that, believe it or not, my coping strategy was picking up a video game console and looking for really aggressive one-on-one fighters. And I just figured, if I'm going to hammer this out, I don't want to hurt a person or me, but I'm going to go all out on the digitized Sprite because they don't feel anything. So, 17 fatalities later, I'm like, all right, I got that out of my system. We good.
You released your anger in a healthy way.
Well, it took a few years, and again, speaking back to my therapist, she was great in teaching me a little bit about anthropomorphic visualization and also understanding to treat emotions and feelings like visitors. So whenever that feeling of anger came, what was it trying to tell me? Why am I angry? And I felt that one of the things that really made sense was cancer ended up being a catalyst that brought all of my feelings to the forefront. So that idea of being confronted with my mortality, just both in the surgical sense, but also really understanding in retrospect, oh my God, I had cancer. I could have died, not once, but twice, 3 times, including the surgery. And I got through it. So every time I'm looking at my life, I'm like, why am I doing this? Why I beat cancer. And it turned into this sounding board for life. And within certain things, it shifted my perspective. So I definitely went through the angry phase because it was a whole lot of why me. And then when I started off at the beginning of this interview saying, it was the most reluctant, brutal teacher I ever had.
Yeah.
It was, why not me?
Yeah.
And that's how I ended up looking at it, inclusive up to today.
So you learned more about emotions than you ever may have actually learned because of what you had to go through.
Definitely. I learned very much the only thing I can control is how I react.
Yeah.
And it taught me that in a really grounded way. And that ended up transcending into every dimension of life. One interview I did was for a live panel discussion for Young Adult Cancer Canada. Just in the moment, it just popped out of my mouth. And I said, I can't believe how my world changed as soon as I started seeing everything through chemo-colored glasses. And it's true. It gives you a different perspective. And depending on where and how you choose to metabolize, where and how you choose to like really digest and process everything you've been through, and then incorporate it into your daily schema, that will alter you as a person. And you see that shift. Those who are close to you will see that shift, and it's your own journey. It's your decision on how you want to navigate that.
How important is the peer support side of it for men who go through this?
Massive, 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 massive important. When I was doing peer support, and exclusively just for testicular cancer patients, I was dealing more with masculinity issues than I was dealing with the actual cancer conversation, and it all came down to self-perception. Am I less of a man because I've gone through this? How am I supposed to convey myself, as you touched earlier, intimacy-wise to whomever it is I want to share myself with, and self-perception. Am I less of a man? What do I do? And once you started to break through that, and I would come back to the numbers game. I'd say, how much of a percentage of your body do you think your testicles make up? Okay, why is that the defining factor? Because that's where procreation comes from. I banked, you can bank. If it's really that big of a deal, and I'm like, oh, that makes sense. Like, yeah, and unless you're planning on taking your pants off, who's gonna know? Other than you,
So,
and who you choose to tell.
on the psychological side of things, that's a very important journey for a lot of men to go through, and then that's by the sounds of it, a very common thing that they'll struggle with. And actually reframing how they're thinking about that is an important part of trying to deal with this psychologically.
Oh, 100%. It just it totally changes. Sorry, I had to change hands. This was falling asleep.
Yeah.
I've met some guys where once everything's said and done, they totally change their lifestyle. Where they're like, they're going to hit the gym hard. They're going to do this. They're going to do that. Great. If that's what makes you feel good and you're in control, amazing. Others just get back to life, and it was a blip. It was a hiccup. Some guys are fortunate enough to catch it early, where it's one orchiectomy and they walk away.
Yeah.
Surgery and done. And for those ones, I'm very happy for them.
Yeah.
I tell them, I say, I don't want you to go through chemo. I don't want you to go through an RPLND. It's awful. That abdominal surgery, let me just say, innards do not like to be handled. And it takes a while for them to readapt themselves. They've been sitting in the same spot at that point in my life for 27 years. And then, being on a no-food diet and bedridden for a week in the hospital during a sweltering August, even with air conditioning in the hospital, it was not fun. And seeing myself lose weight over that 7 days and how much I had changed. And then the first time, getting a catheter takeout is not the funnest thing. And then having to share tips and saying things like, as soon as that's done, the first time if you're going to go to the bathroom to urinate, sit down. Don't try to stand up. It's like you get hit in the gut with a bat. Yeah. It's just like I immediately toppled over. I had no idea that's what I was going to feel. And so it's just the peer support factor is huge because you have other roadmaps to gauge what you might have in store for you, and at least that's something's better than nothing.
If someone has just been diagnosed, what is the first thing that they should do? Should they be kind of Googling and looking for that peer support rather than trying to kind of Google the information and try and figure it out for themselves?
The first thing that I would say to someone is when they're diagnosed, if they have someone with them there as a supporter at the moment the first thing I would say is the founder for Young Adult Cancer Canada, I think he phrased it really, really well to say, from the moment you're diagnosed, the first second, you're a survivor. Embrace that. understand it. There is no wrong way to approach these things, but if you happen to have someone who's with you who has that objectivity, they can be your advocate in the moment while you try to emotionally process what's going on. If you do not have that advocacy with you in the moment, you're on your own, it's okay if you don't ask all the questions at the right point in time. I'd say get all the data you need, get the contact information, understand who your team is, and know that their job is to help you get through this. They're going to do their absolute best to try to get you to beat this thing, and your responsibility is to show up, do your part, bring your best game face as best as you can, and then work together, because they are your advocates, they're your champions.
How many years has it been actually since you had the cancer the second time?
Oh, so that was January of 2006. So yeah, it's over, is that 15 years? No, coming up on 15 years.
Yeah, I'm terrible at maths. How do you feel how do you feel in yourself physically? How's your health been in recent times?
Well, I ended up finding I got the RPLND done, and within the first 9 to 10 weeks of the surgery way back when, I had this bump just to the left of my navel. Didn't think much about it, and it started getting a little progressive, and it was like it moved, and I thought, all right, long story short, I looked for cosmetic treatment, going, okay, well, it's probably keloid scarring or something, whatever. It turns out that I had a post-surgical umbilical hernia for 10 years, not aware of this, working out on it, doing recreational adult gymnastics on it. Like, I was doing backflips. I'm like, whoa! And I got it fixed just last year in January, so fortunately it feels good. And I've just learned to make the best of what I've got in front of me. Very fortunate, this coming October will be 3 years since I married my husband, and it's making the most. Like, just the thing is, we all have different perspectives on what we gauge as being our best. Yeah. Today might not be as good as yesterday, and tomorrow might be astronomical in comparison. But if you know that you've given it 100% for whatever that is, you have that sense of peace, and it's okay. Yeah. You don't have, like, not what's that expression? Not all superheroes wear capes.
Yeah.
We can all do it our own way, and my personal experience and my solace comes from getting to do things like this, where if I know that I'm able to flash my roadmap and it makes sense to somebody, it could be testicular cancer or anything. Like even on my Instagram, how we connected initially, I keep myself open.
Yeah.
Just because I've had guys reach out to me from around the world, just saying, like, this is what I'm going through. And of course, I give my immediate caveat. I'm not a medical practitioner, but I can tell you what I went through. And if you're concerned about what your steps might be, tell me what's going on. And if it makes sense, sure, this is what I would do.
Yeah.
And then they come back, and so far so good. It's no added names from the internet, but I'm glad that I can do my part. I mean, where's the point in me having all this experience and just hoarding it to myself?
Yeah.
Especially if I can pay it forward and help someone out where I didn't have that tool back then.
Yeah.
I didn't have anything that even came close to it. So I got approached, and I've been working as a contributor for this really great cancer companion app called Elly, and it's available on all smartphones for download.
How do you spell it?
What it is, ELLY.
Peter, thank you so much. It's been a really enjoyable interview, and you've taught me some things as well that I didn't know. So it's been an absolute pleasure.